If you're looking for lower back pain exercises that you can do at home, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain 4 lower back pain home exercises that people commonly do wrong, and how you can do them correctly so that they actually help your lower back pain. Plus, in the second part of this video, I'm going to explain how to upgrade these exercises so that they work even better. But before we get started, it's really important that you understand 3 reasons that lower back pain exercises don't commonly help people with their lower back pain. And largely those are that people either don't do them often enough, they do them with improper technique, or they don't stick with them for long enough to see results. And I mention that because when you see the actual exercises, these aren't fancy exercises. You've probably seen them before, but experts in any industry don't do extremely fancy things. They execute the basics very well. And so these are basic exercises. You've probably seen them, but if you've been doing lower back pain exercises and you're still having lower back pain, chances are probably that you don't do the exercises often enough. If you do them, then maybe you do them with improper technique, which we'll fix in this video, or that you're always looking for new exercises, and it may not be that you need new exercises, just better execution of some of the exercises that you're already currently doing. So without further ado, let's get into the 4 exercises. And those 4 exercises are the clamshell, the bridge, the bird dog, and the plank. So for each of those exercises, I'll explain what the intended effect of the exercise is, the common mistakes that people make, and then how to do the exercise properly. So the first exercise, the clamshell, the purpose of it is to stabilize the spine while moving your legs. And really that's the purpose of all 4 of these exercises, is core stabilization while you're moving something else. Now with the clamshell in particular, it's to stabilize against rotation of your spine. Your lower back actually wasn't made to twist. The facet joints, they lay inside of one another. And so there's only a few degrees of rotation at each level. And if you go further than that, then you start twisting and shearing on the discs in your lower back, which can set you up for injury. And so you really want to prevent excessive amounts of twisting or rotation in your lower back. Now, a common mistake that people make when doing the clamshell exercise is they allow too much rotation. So if you're laying down to do the clamshell exercise, this is commonly how people do it. And you'll notice I'm kind of rolling back here a little bit, which is trunk rotation. If your belly button moves, you're rotating your trunk. To see that from an opposite direction, watch right here. You'll see my lower back twists or my pelvis rotates. And that means you're not doing the thing that the exercise was designed to do, which is stabilizing the trunk while moving at the hips. So to do that exercise properly, you'll lay down on your side, roll forwards a little more than you think you would have to, so your belly button's slightly pointed towards the ground. And what that does is it activates the back part of your gluteal muscles, the back part of your gluteus medius, as well as your hip external rotator muscles. And it doesn't allow you to use your tensor fasciae lata, a hip abductor that's in the front part of your hip. So you want to roll forward just a little bit, kind of pull your belly button in to tighten your core, then take your hand, put your thumb on your hip bone. If you feel right here, there's kind of a bumpy part, put your thumb there, and then your 4 fingers back this way. Now with your thumb, you want to make sure that you don't feel any movement in that bone. If you feel that bone move backwards, then it tells you that your pelvis is rotating. So you want to make sure that thumb doesn't move. With your 4 fingers, you put them on your butt, and you should feel the muscles contract back there. That's your gluteal muscles firing. And so when you do that correctly, you can see it's a fairly tiny movement. But it's very rare in everyday life that we have to open our hips out quite that much. So it's not necessarily important that you get a large range of motion. It's more important that you don't move at your core, that you stabilize at your core, and that you activate your glutes. So again, to do that exercise correctly, you lift your knee up, tighten your glutes, tighten your core, and it may be a very tiny movement, at least to start. So that's the first exercise, the clamshell exercise. Now, the second exercise is the bridge. And the purpose of the bridge is likewise core stabilization while going into hip extension. So with the clamshell, you're doing hip rotation. With the bridge, you're doing hip extension, which means moving your thigh backwards. And so here's how people commonly do the bridge. I'm going to tuck this in so that you can see my lower back here. So when people commonly do the bridge, they bridge up really high, and you can see how my lower back goes into an arch. Now, when that happens, it jams the facet joints in your lower back together, and furthermore, it narrows the openings where the nerve roots come out of your lower back. And so that can create lower back pain, particularly in people who are sensitive to lower back extension. And so to do the bridge properly, you want to start out by doing a pelvic tilt where you pull your belly in and try and flatten your lower back out so that there's no space between your lower back and the ground. Try and get your lower back flat on the ground. And if you can't even do this, this is probably the place to start with just doing a pelvic tilt. But assuming that you can do a pelvic tilt, then the next step to go into a bridge is to maintain that pelvic tilt, keep your lower back flat, and then push your heels into the ground while squeezing your glutes so that you lift your pelvis up. Now, the key to this is that you can't lose the pelvic tilt. So if you start arching your lower back, you've lost the pelvic tilt. And that again means that you're probably going to move much less than you may be used to doing. So again, pelvic tilt, flatten the lower back, and then push the heels into the ground, activate your glutes, and then roll your pelvis up off the ground, lifting your butt up, but not losing that pelvic tilt. And so that's the second exercise, is the bridge. Now, the third exercise is the bird dog, and that is meant to control both extension and rotation at the same time. So if you're not familiar with what the bird dog is, it's named because it kind of looks like a hunting dog where you're going bird hunting. And you're on all fours to do this exercise. And then how you would do it is raise one arm and one leg, and then the opposite arm and the opposite leg. So it's like a hunting dog pointing. Now, the mistake that people commonly make is that they either allow too much extension in their back, they get back arch, and or they rotate. They allow their spine to twist. And so to do this correctly, you want to make sure that you first kind of stabilize your trunk, start out going all the way up into a pelvic tilt, then all the way down, and then find a midway position and just try to maintain that position. Then slide your leg out behind you and make sure that you don't get too much extension, or also that you don't get rotation, either letting your hip drop or raising your leg too high up in the air. And then if you can get your leg out behind you without extending a rotation, then add the arm into it. And then come back down. And again, you don't want to allow that extension or rotation of your lower back. Then you do the opposite leg, get your core tight in a mid-range position, slide the leg out, and then add the arm in. And so this is more about control. It's better to do a few good repetitions than a whole bunch of bad repetitions. And you may be wondering, well, how many sets or repetitions should I do of these exercises? And the truth is, it doesn't matter, and it's going to change for each person. You want to do as many repetitions as you can with good technique, no more and no less. There's no standard 1 set of 10 or 3 sets of 10 that's perfect for every single person. It's actually more important that you do your exercises often, meaning do them regularly, do them every day, at least once a day if you're having lower back pain. And what that does is it actually retrains your brain to produce new movement patterns. So it's more important that you stimulate and utilize those movement patterns on a regular basis than necessarily if you do 10 repetitions or 12 repetitions or 2 sets of 10 repetitions. Just do the exercises often enough that your brain's learning those new movement patterns. So that's the third exercise, is the bird dog. Now, the fourth exercise is the plank. And the plank is so named because you ideally want to make your body straight like a plank from shoulder to ankle. In reality, that rarely happens. So this is what the plank looks like, where you lift up like this and you try to create a straight line between your shoulders and your ankles. Now, what most people will do is they'll allow their lower back to sag like this. And so that creates arch in your lower back. It also means you're not utilizing your abdominal muscles. Now, the proper way to do this is to contract your abdominal muscles as well as your gluteal muscles at the same time so that you're keeping your body straight. And so to do that, it helps to actually tent your butt up in the air, tighten your abdominals, and get your abs tight. Hold that abdominal contraction, then squeeze your glutes to push your pelvis down to the floor. Now, I'm sure that I'm not completely in a straight line here, and that's okay because the abdominals are firing, the glutes are firing, and the lower back is in a straight position. So it's more important to have a straight line from here to there without getting a lot of sag in the lower back than it is to have a straight line from your shoulder to your ankle where your pelvis sags down and your lower back is arched. So again, to show the correct performance of the plank, you get on your elbows. You can actually do it from a push-up position as well, but get on your forearms like this, come up here, bring your butt up in the air and tighten your abdominal muscles so you get your lower back in a neutral position. Then squeeze your glutes to bring the pelvis down towards the floor, but much like the bridge, only as far as you can without allowing your lower back to sag down and arch. So that's the plank. And again, to review, those 4 exercises were the clamshell, the bridge, the bird dog, and the plank. Now, one thing you might notice about all 4 of those exercises is that we were on the ground doing all of those exercises. And there are a few problems with that. In fact, I rarely give patients any of those exercises anymore. They're great exercises, but like I mentioned at the beginning of the video, one of the reasons why exercises don't commonly work is people don't do them often enough. And if you have to get down on the ground or if you have to lay down to do your exercises, then you're less likely to do them. Chances are, if you're a busy person, then you may only get a chance to do them first thing in the morning or in the evening before you go to bed. And furthermore, if you have back pain and you have trouble getting down on the ground, then it's likely that you're probably not going to do them quite as often as if you had some exercises that you could do either sitting or standing up. And so for those reasons, I usually try to give patients exercises that they can do during the course of the day, wherever they have time to fit it in, where they don't have to get down on the ground. If you're at work, you'd look kind of silly getting down on the ground to do your exercises, but chances are if there's something you could do standing or sitting down, you could do it multiple times per day without having to set aside a lot of extra time to do your exercises. And so that helps overcome the first problem of not doing exercises long enough. So how do you upgrade these exercises? Well, in order to do that, you have to stand up. So now that we're standing, how do you take those 4 exercises and combine them into more functional movement patterns that you can perform throughout the day without having to get down on the ground? Well, for the first exercise, we're going to actually combine 2 of the exercises, and those are the bridge and the plank. If you think about what you're doing during those 2 exercises, you're activating your abdominals as well as your glutes and trying to get your spine in more of a neutral position. And so to do that in a standing position, you tighten your abdominal muscles, roll your pelvis slightly underneath of you, and then squeeze your glutes. And you hold that ideally as often as you can throughout the day. Now, if you're really squeezing your glutes and squeezing your abdominals hard, you're going to tire out quickly and you're not going to be able to maintain that all day long. But even if you can just do 20%, get a little bit more into the habit of tightening the abdominals and rolling your glutes under, that's going to put your spine in a more functional position so that the facet joints aren't jamming together, so that you're not narrowing the spaces where the nerves come out and go down into your legs. And that's going to help you be able to stand more comfortably throughout the day. It's actually more important to be able to maintain a good spinal position throughout the day and have your muscles work longer than to do really intense exercises to get them stronger. For most activities that we do during the day, we don't need all of our strength. It's actually really only a small percentage of it, but we need to do it all day long. And so developing the endurance of those muscles to tighten your core, tighten your glutes, will help you be able to stand longer throughout the course of your day, particularly if you're someone who gets lower back pain when you're standing, or your lower back pain tends to be worse as you get towards the end part of the day. Now, what about the other exercises? What about the clamshell and the bird dog? Well, those exercises help to stabilize against rotation or twisting of your trunk. And that happens when you go to take a step. When you put weight on one leg, if your knee caves inwards that way, it causes your hip to go inwards like that, as well as it can cause pelvic rotation, which causes twisting at your spine. So in order to prevent that, you want to be able to keep your pelvis neutral as you go to take a step. And so to do that, you want to start in a position like you're going to take a step. And then if you remember how to do the clamshell from before, where you're tightening your abdominals and kind of turning your knee out by squeezing your glutes, that's how you're going to do this exercise. So it's just like doing a standing clamshell. Now, the further forward you go and the more weight you put on this foot, the more difficult the exercise becomes. So going more forward into this position and turning the knee out, that helps activate your glutes to a greater extent so that you can keep your body stable as you go to load weight on it and take a step forward. To see that from the side, you'll take a step forward, tighten your abdominals, turn your knee out so you're firing your glutes, and then the more weight you put forwards on this leg, the harder the exercise gets until you go to take a step. And that's actually where the bird dog part of this exercise comes in. That if you really want to do a standing bird dog, squeeze your glutes, do the clam exercise, and then once you get in this forward position like this, pick this leg up off the floor and try and balance and maintain your balance without extending your spine, with your hip behind you. And so now you're kind of doing a clamshell and a bird dog per se at the same time. Now, that's a pretty difficult advanced exercise. So I would recommend that if you don't have good balance, or if you're trying this for the first time, that you do it by something where you can hold on just in case you lose your balance so that you don't fall over. And so you'll take a step forwards, do your standing clamshell, hold on if you need to, and lift the other leg up like you're doing the bird dog. So those are 2 standing upgrades that help you to take those 4 exercises and turn them into more functional activities. So hopefully you did find this video helpful. If you live in the St. Louis area and you need more help for lower back pain, feel free to reach out to us at More for Life. And if you're watching this video from somewhere else but you found it helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.